Hospitals are meant to save lives. But what happens when the very systems designed to protect patients are turned against them? This is the real story of a ransomware attack that paralyzed a hospital in the United States, crippled by RyUK, one of the most dangerous malware strains in the world. A breach that cost lives, millions of dollars, and revealed how vulnerable modern medicine is to cybercrime. This is Code Black. It started in September 2020, when Universal Health Services, UHS, one of America's largest hospital chains, noticed strange activity on their networks. Staff across the country reported system crashes, screen freezes, and sudden logouts. Most thought it was just a glitch. But behind the scenes, an attack had already begun. RyUK Ransomware had infiltrated their systems through a phishing email. Experts believe the malware was delivered in stages, first with Emotet, a Trojan, followed by TrickBot to spread laterally through networks. Once embedded deeply, RyUK launched its payload, encrypting thousands of files across 400 facilities. Doctors and nurses lost access to patient charts. Emergency rooms were forced to reroute ambulances. Electronic health records became inaccessible. Some medical devices malfunctioned. UHS facilities resorted to paper records. Communication broke down. At one Pennsylvania hospital, a nurse recalled a baby in distress, but her vitals couldn't be accessed digitally. Delays in care became inevitable. Patients were transferred to other hospitals. Surgeries postponed. Mental health facilities were especially hard hit, forcing some to turn away critical cases. In Alabama, one woman claimed her baby died during a similar ransomware incident at Spring Hill Medical Center. Though legal disputes surrounded the case, it highlighted the stakes of digital failures in healthcare. RyUK was first discovered in 2018 and has been linked to Russian cybercriminal groups. It's designed to target large enterprises and critical infrastructure. What makes it deadly is its stealth. It disables antivirus software, encrypts backups, and demands huge payments in cryptocurrency. RyUK is often deployed manually, once the attackers have mapped out a system, stolen credentials, and selected high-value targets. These are not smash-and-grab attacks. They are calculated digital heists. By 2021, RyUK had earned its creators over $150 million in ransom payments. Many victims paid quietly to avoid media attention. But not UHS. RyUK was first discovered in 2018 and has been linked to Russian cybercriminal groups. It's designed to target large enterprises and critical infrastructure. What makes it deadly is its stealth. It disables antivirus software, encrypts backups, and demands huge payments in cryptocurrency. RyUK is often deployed manually, once the attackers have mapped out a system, stolen credentials, and selected high-value targets. These are not smash-and-grab attacks. They are calculated digital heists. By 2021, RyUK had earned its creators over $150 million in ransom payments. Many victims paid quietly to avoid media attention. But not UHS. UHS refused to pay the ransom. Instead, they shut down systems, disconnected affected devices, and brought in cybersecurity experts. Recovery took over 3 weeks. Costs: more than $67 million in damages. During that time, chaos reigned. Staff were overworked. Patients missed appointments. In some cases, delays in lab work led to incorrect treatments. The attackers were never publicly identified. But forensic evidence pointed to Wizard Spider, a criminal group operating out of Russia, known for RyUK and Conti ransomware. The attack forced the U.S. government to re-evaluate cybersecurity for critical sectors. RyUK became a case study in cyber warfare against healthcare. What can we learn from the RyUK incident? White heavy checkmark always train staff to recognize phishing emails. White heavy checkmark never rely solely on online backups, keep offline copies. White heavy checkmark invest in endpoint detection and response systems. White heavy checkmark segment your network to prevent malware from spreading. White heavy checkmark and above all, plan for the worst. Because in healthcare, minutes matter, and digital systems are the heartbeat of modern care. RyUK was not just a wake-up call. It was a siren. One that echoed through hospital corridors and operating rooms worldwide. This was Cyber World Tales. Subscribe to uncover more real-life cyber incidents, where bytes meet blood, and the cost of vulnerability is measured in lives.